So actually, I think there's a greater and greater appreciation of the role of other cells aside from the tumor cell in exactly how the tumor cell behaves. I often joke and say that the neighborhood very quickly deteriorates where you live when that weird family moves in and has all kinds of strange behavior, and everyone wants to get out of the environment. So the tumor is very influenced by the microenvironment, but the microenvironment is also influenced by the tumor. So a lot of the data that we're seeing and hearing today is that there are other cells in the environment, but there are also stromal elements within the environment, all of which is regulating tumor growth, and the tumor growth is actually defining and developing its microenvironment. So cells that really appear to be highly relevant are cells like T cells that we think are trying to regulate and control the cancer cell. But then there are other cells like myeloid-derived suppressor cells and other cells like monocytes and macrophages that are very suppressive, and their presence actually favor the growth of the tumor. And then there was some very interesting data, even talking about the stromal components, the almost non-cellular components, and its role in creating growth and growth environment for Waldenströms. And what we see there is those cells make all kinds of products and proteins that really favor the growth of the tumor cell. So while you might have thought that stroma was just sort of, the structure in the background, it's very dynamic, doing all kinds of things. So the question about does it impact drug resistance? Certainly, if you actually have tumor cells isolated out of the bone marrow, they fail to thrive. Back in the bone marrow, they're very comfortable growing, and even with chemotherapy are much more resilient when they have all of this support around them. So to the future, I think if we can disrupt some of these processes that are favoring the tumor and create an environment that doesn't, that really gives us all kinds of treatment options.